COVID-19, named for the year it was declared, is now still dominating the headlines in 2021. It is affecting and has affected every fabric of life around the world. And with cases rising again, it doesn't seem to be getting any better. Here stateside, the NFL today sent a message to all of its 32 teams: get vaccinated or else. The league announced that teams unable to play games because of COVID outbreaks among unvaccinated players will forfeit games that can't be rescheduled. In the 18-week regular season, players on both teams will not be paid for games not played, but the league said it will offer some leniency for players who have been vaccinated should they get the virus. And in global sports, less than 24 hours out from the opening of the Tokyo Olympics, it's reporting its highest number of COVID cases in 6 months in Tokyo. Take a listen.
We have to remember, particularly in relation to spreading outside the village, the degree of contact between the international community inside the village and the local Japanese population outside is extremely small.
Still, Tokyo has recorded 1,979 official cases on Thursday, up from 1,300 or so on Wednesday, as the Japanese government accelerates vaccinations with an eye toward avoiding overcrowding their hospitals there. Meanwhile, in Britain, coronavirus cases have been steadily rising, and the NHS COVID tracing app has a record number of Brits self-isolating now. That means another round of pandemic pandemonium, with supermarkets and wholesalers facing shortages as people stock up on necessities. Supermarkets have urged Brits not to panic, purchase items like toilet paper, pasta, bottled water, and the other thing they're running short on, wine. British ministers are facing calls to bring in the army to try and shore up the food supply. We've checked around. So far, no toilet paper or wine shortage as of yet reported here in the United States. As COVID concerns continue to dictate conversations around the world, here in the States, we seem to have divided into two Americas, the vaccinated and the unvaccinated. And with infection rates surging, the country is forced to face the stark economic differences for those living in rural versus urban, more populated areas. Alabama, Mississippi, Arkansas, and Louisiana and Wyoming post the lowest vaccination rates in the entire United States. To talk about this today, we have Dr. Ashish Jha, a practicing physician who's recognized globally as an expert on pandemic preparedness and response. We also have Dr. Gloria Richard-Davis, a fertility specialist at the University of Arkansas for Medical Sciences, who spent the pandemic reaching out to rural groups with concerns about COVID and who don't have access to a wealth of information about the vaccine. Dr. Richard-Davis, we're going to talk to you in a moment. First, want to start with Dr. Jha, who's led groundbreaking research on Ebola and is now on the front lines of the COVID response. Doctor, appreciate you being with us. As we look at this, fair to say that we now have two Americas?
Yeah, first of all, Leland, thanks for having me here.
Thank you.
It is fair to say we have two Americas, not just in terms of people, vaccinated and unvaccinated, but communities, right? As your map showed, there are communities, there are entire states with very, very low vaccination rates, and they're the ones that are seeing massive spikes in cases right now. And there are other places with high vaccination rates. They're seeing small bumps. But the bottom line is they're in much, much better shape. Yeah, well, and we've got to make all of America look like that America. We've got to get a lot more people vaccinated.
Well, they're seeing small bumps among the unvaccinated people in these large metropolitan areas. We're now hearing that a number of school districts, including some of the biggest in America, are talking about having mask mandates for students and faculty come the fall. So if vaccines are settled science. They work. We can tell that. We can tell that from the data. Why would someone who was vaccinated need to wear a mask?
Yeah, it's a fabulous question. So look, first and foremost, in terms of schools, thank God we're getting kids back into school full time.
Yeah, for sure.
We should just celebrate that. Mask or no mask. All right. Now, the second issue is, why should vaccinated people wear masks? Well, one major reason is we can't tell who's vaccinated and who's not. Schools are not requiring vaccinations. They're afraid to check vaccination status. And therefore, if they know they're going to have a lot of unvaccinated people in their midst, it's just much easier to make a broad mandate for everybody. Much easier if you could just say, hey, if you're either vaccinated, if you're not, you got to wear a mask.
Right.
That would be reasonable, but schools don't want to figure that out.
Well, that's a different question, though. That's really not a medical question as much as it is a public policy question. So what I'm hearing from you is it sounds like this is going to be around for an awfully long time, because all the studies show that people who are unvaccinated as of today aren't likely to get vaccinated anytime soon. Nobody's not getting vaccinated because they don't have access to the vaccine. So do we have to accept that COVID is just going to be part of life, like the flu or the common cold, but one that you can choose to protect yourself from?
Yeah, so first of all, I do think COVID's going to be around for a long time. It's going to be endemic, right? It's just going to be one of the viruses we deal with.
At some point during this interview, Doctor, we're going to get some good news out of you.
Yeah. No, I'll tell you this, right? Look, there is good news. I mean, the biggest good news is these vaccines are awesome.
Right.
Like, get yourself vaccinated, and then you can really stop worrying about this. So that, like, I don't know. I don't have any better news than that. But the bottom line is
it's got to be kind of difficult, though, in the sense, because you keep saying, it's great news the vaccine works, but gee, I may have to still wear a mask. My kids are going to have to wear a mask. We're already talking about restaurants shutdowns again. At what point do we not manage this to zero, as some in your profession want to do? And we say, if you don't want to be vaccinated, that's kind of your choice. The rest of us who are just going to go about our life.
Yeah, here's the problem. Look, I'm totally with you. We're not getting to zero. I'm not worried about getting to zero. The issue is this. There's so many people who are unvaccinated. We're getting these massive surges in cases. Those people are ending up in the hospital and filling up the hospitals. When the hospitals get totally full and can't take care of anybody, that's a problem for all of us.
But are we really?
It is a problem that we got to deal with.
Yeah, but we're not anywhere close to that in any major American city by any stretch of the imagination.
We are in certain places. We're not going to get there in Boston or New York, but we are
Springfield,
there.
Missouri. I heard a couple others. This is Dr. Fauci talking about this. I want to get your thoughts on his comment. Take a listen.
Even if you're vaccinated, it's suggested that you wear a mask when you are indoors in a situation where you have a level of dynamics of virus in the community that's high. So I'm not sure exactly where you are or what the dynamics are in the region that you are, but you might want to consider, if you want to go the extra mile of safety, even though you're vaccinated, when you're indoors, particularly in crowded places, you might want to consider wearing a mask.
That seems a little different than what you said, because you said wear a mask because we want to have mask mandates because we can't tell who's vaccinated. He's saying even if you're vaccinated, you need to wear a mask for protection. Again, if you're vaccinated and vaccines work, why would you need a mask?
Yeah, great question. So look, first of all, nothing in life is 100%, right?
Fair.
So the way I look at it is I live in Massachusetts. Infection rates are really low, high number of people vaccinated. I walk into a grocery store, I'm not wearing a mask. Okay. If I was in Southwest Missouri, I would wear a mask. Now you say, well, why do you care? You're vaccinated. Because people who are vaccinated can still have breakthrough infections. And breakthrough infections aren't going to kill you. They're not going to land you in the hospital, but they're miserable. I don't want one. And if I can wear a mask and avoid it, I will.
I guess that goes back to
that. Maybe not.
Yeah, no, I mean, I guess that goes back to the question. You've had a great conversation about this in terms of, maybe that's a personal choice at some level and one that you laid out. Dr. Jha, I was told before I'd interviewed you, we've never gotten a chance to talk, that this was going to be a great conversation, and you exceeded very high expectations. We appreciate your time, sir. Come back often.
I would be delighted. Thanks so much for having me on.
Thank you. Bring in now Dr. Gloria Richard Davis, who practices in Little Rock and is with the University of Arkansas Medical Services. You're a fertility specialist who's been reaching out to these more inaccessible rural areas. We put that map up. Those in Arkansas, with some of the lowest vaccination rates, to answer questions they have before committing to getting vaccinated. I want to look at something you said recently in an interview. This is the reason we're having you on today. And you talked in your interview about sort of needing to accept people where they were at and not call somebody who doesn't want to get a vaccine a tin hat conspiracy theorist. A lot of celebrities are coming out saying the vaccine, the average person is not listening to them. So we're trying to understand who the everyday influences are for our community, and the community health workers are part of that because they live and breathe. We saw that and really wanted to have you on, so we appreciate you being here. You listen to this media narrative that all the unvaccinated people are Trump voters who just won't get the vaccine. Is that what you're seeing, or is there more to it?
Oh, absolutely not. There is a lot more to it.
Okay.
It's multifaceted. None of our communities are monolithic. And so one of the things that we have done is we have conducted community advisory boards, which means that we're talking specifically to individuals in the communities who have chosen not to get the vaccine and trying to understand what their rationale is.
What are they telling you?
They're voicing concerns about distrust and misinformation, which is what we're all hearing. There's also that disinformation. I think there are some campaigns out there that's
for sure. We know the Russians, the Chinese, a lot of people are behind that. This is one that fascinated us. Brian Enton last night was down in Miami at a COVID ICU where 46%, none of the people in the ICU were vaccinated. All the patients were unvaccinated, but 46% of the healthcare workers in that hospital were unvaccinated. He heard from a number of nurses there who were young women of childbearing age, women who want to have babies, who work around people with COVID. And basically what he was hearing is that they would rather risk death from COVID than be safe from COVID and risk a child medically injured by an untested COVID vaccine. There's nothing political about that. That seems to be women who trust science, who are nurses worried about the lack of science.
You know, first of all, we have to recognize that healthcare providers, again, there's a broad variation, right? So not everybody who is in healthcare necessarily understands all the detail, nor they understand what the publications are actually saying. Now, we have healthcare organizations that are specifically focused on reproductive capacity, both in terms of women who are currently pregnant and what the outcomes are with COVID versus those who have been vaccinated. And what we know is that vaccinated pregnant women have no increased risk of preterm labor or any other adverse outcomes during their pregnancy compared to women who do not have.
You know,
right?
but I think you'd agree, though, that if you think about women who've gotten the vaccine even a year ago in the original clinical trials, if they had gotten the vaccine, immediately gotten pregnant, they'd just be having their babies right now. We really have no idea what the outcome for those babies is going to be for at least a couple of years, right? So we're talking about a pretty small sample size.
Yes, but we also have to think about organogenesis, right? So fetal development. Fetal development occurs within the first 10 weeks of pregnancy. So we know if there's going to be any sort of congenital anomaly in those babies.
Yeah, that's an interesting point. I'm sure one that you're making to a lot of these nurses and other healthcare workers who are talking about it. Doc, we really appreciate you being here, and we really admire what you had to say in that article.
Thank you so much for having me.
Thank you, ma'am.